Bupe in the Field program is a program that started in Contra Costa County as a pilot where the ambulances have buprenorphine on board and can treat patients right there on the spot.
Alongside our partners in Contra Costa Fire, we go on about 700 opioid overdoses or suspected opioid overdoses a year. The vast majority of those patients get Narcan. About 10% of those patients get Bupe. This is a strip of buprenorphine. We administer it sublingually, so we put it under the patient's tongue. It does take a little while to dissolve, but the symptom relief that comes with it is relatively quick.
My name is Senai Kidane. I'm the County Medical Director for Emergency Medical Services here in Contra Costa County. I will admit to you that I was actually one of the skeptics when I was first heard of this program. What I have learned is we have a powerful, powerful role in intervening at a very, very critical step. Many individuals who have experienced overdose experience very powerful withdrawal symptoms that cause them to leave against medical advice and potentially overdose again or overdose in more lethal ways. So we want to break that cycle.
So the vast majority of the calls that we use this on are actually opioid overdoses. For the patients who we give Narcan to, they wake up, they're uncomfortable, they're sweaty, they've got runny nose, heart rate is high, they're in pain. We ask them if they'd be interested in getting Bupe. It's the best symptom relief we have right now. And this could be the start of a journey, if you're ready for that, into less opioid use. And there's folks at the hospital who want to speak with you about it if you're interested.
Starting in the field, oftentimes by the time they get to the hospital, they're already almost out of withdrawal, like barely having any symptoms at all, depending on the transport time. And I think that's so significant. I work at the Contra Costa Regional Medical Center, and some patients are transported there. I'm there to meet with the patient when they get there, meet them where they are, just provide a level of comfort and let them know that before you leave here, we can make sure that you have a prescription for buprenorphine to continue.
So what I do as a substance use navigator, when a Bupe in the Field comes in, we schedule them and then we'll reach out to them with a phone call. We follow up. We also do a 7-day follow-up, and then we would also do a 30-day follow-up. And this is to let the patient know that they have support. They don't have to go through this alone.
There is stigma attached to opioid use, right? And that's real in EMS. And I think taking the time to work with your providers to overcome that. Humanizing the patient at the other end of the line there is, I think, something that's critical to do anyway, but is helpful in getting providers more confident in administering Bupe.
I get an email anytime that somebody overdoses in Contra Costa County, whether they received buprenorphine or not. I can tell, like, as the medics are writing about their interaction with the patients, that it's changed a lot. The language is less stigmatizing and more about helping somebody right there.
I'm sure at the beginning it was a little bit like building rocket ships in flight, but now we can hand a program to somebody and say, here are all the pieces you need. Here are suggested policies, here are suggested protocols, here is how to order this medication, here is how much it costs, here is the training that you can use.
We conducted a pilot here in Contra Costa that showed that from patients that receive buprenorphine from one of our paramedics in the field, approximately 30% of those continue in addiction and treatment services 1 month out from their initial encounter with our system. And I think that that's a remarkable achievement.
It makes it such a better experience for not only them, but also for us. It makes it safer for us, it makes it more comfortable, and then if they can hook up with more longer-term services, that's the icing on the cake. But even if they can't, just during transport, it makes a huge difference.